This old photograph of a miner carrying a canary into the mine. They used to be used as an early warning for miners because they're much more sensitive to carbon monoxide poisoning than humans. So when a canary staggers and falls off the perch, the miners knew to get the hell out of there. Carbon monoxide is an odorless, tasteless, colorless gas. You probably know just how dangerous it is in the home, where it can't be detected if you don't have a device. Well, we didn't have carbon monoxide devices to test for carbon monoxide until recently. So they used canaries because, as Dr. Greek said, the respiratory system of the canary is quite different from humans. But a difference that makes no difference is no different. The fact of sensitivity, the fact that a canary is more sensitive than humans to carbon monoxide allows it to be used as a model, as a safety one. And that's exactly what many animal studies are doing. They are not, as Dr. Greek claims, they are not predictors of whether human beings, whether a drug is safe for human beings. They are models to tell us something about the drug, how it's metabolized, how the body of a mouse or a mammal uses it. It gives us the information that we can then use in developing the drugs. Steps in drug development. Preclinical toxicological tests. Preclinical. That involves toxicological tests, animal studies. Next comes phase 1 clinical trial, which requires about 20 to 80 healthy volunteers. Then there's the phase 2 clinical trial, which will use about 100 to 300 volunteer patients. Phase 3 clinical trials require up to 3,000, 3,500, or even more patients. Following the completion of phase 3 trials, the FDA will review the data submitted. The animal studies are submitted to the FDA, and they use that too in order to see things about the drug, such as carcinogenicity and teratogenicity, meaning, does it cause birth defects? You can't it's not ethical or legal to conduct a carcinogenic test or a teratogenic test on a human being. So they're not done. So they use animal models, a number of different species, to learn something to see whether these drugs might, not will, but might cause cancer or birth defects in humans. This is the canary in the mine. This is not not used as a test to see if these things cause cancer or birth defects in humans. This is a misrepresentation of the facts. They are guides to the clinical trials. To put it another way, animal studies of drugs are not used to determine whether these drugs are safe and effective in humans. They are done to generate hypotheses. The hypotheses are then tested in clinical trials using humans. This is a graphic to show you just how complex the drug approval process. But animal testing just collects the information that's useful for doctors and researchers to test them in humans. Accutane. Accutane is a vitamin A. It's similar in structure and function as vitamin A. The actual name is isotretinoid. Accutane is the product name, the trade name. Its insert warns very, very, very strong warning. It causes birth defects. It is a major, very powerful teratogen, causing about 20% of pregnant women who take this drug during the critical time will have a child with birth defects. This was not discovered in humans. It was discovered in animals. Or I should say it was predicted by animal studies. Vitamin A, high doses of vitamin A causes birth defects in animals. So when this drug came along and was about to be marketed, the FDA and researchers knew they had to watch this very carefully because vitamin A, large amounts of vitamin A in the body, a small amount of it is turned into isotretinoin, which was a very powerful teratogen. Well, sure enough, they watched. And when the first defects, birth defects, started to appear in women who had taken isotretinoin, the alarm really went up and they started getting very serious about this warning. So again, the animal studies was a canary in the mine. It was not a test to see whether it's safe in people or not. Clinical trials are done to determine that. Vioxx. There's that article in the, all right, don't have it. There's an article in Good Medicine which blames the Vioxx debacle on animal studies. And Dr. John Pippin, a cardiologist, a member of the so-called Physicians Committee for Responsible Medicine. By the way, did I tell you the Physicians Committee for Responsible Medicine has very few physicians? Only 5% of the members are physicians. As often said, Physicians Committee for Responsible Medicine is neither a committee of physicians nor a committee that advocates responsible medicine. Dr. Pippin, the cardiologist, wrote, "Good science could save consumers from the next Vioxx, but that won't happen unless the government stops relying on antiquated animal tests." And he says, as a first step to keeping consumers safe, the FDA must stop pretending that animal tests accurately predict results in humans. If you take a look at the labeling, FDA-approved label that goes with Vioxx, and try to find anything in there about animal studies, except for teratogenicity and carcinogenicity, you'll find nothing, because the approval of Vioxx by the FDA was not based on the animal studies. It was based on clinical studies, phase 1, phase 2, phase 3. Animal studies use about 1,500 animals. That's the preclinical research that's necessary. Following that, as I said, there's the clinical trials. Up to 3,500 people. Now, the problem with Vioxx had nothing to do with animal studies, contrary to what PCRM and its propagandists have been saying. The problem with Vioxx has two parts. One is the advertising. In the old days, before drugs were advertised on television all over the place, it took time for a new drug to get out to the market. By then, doctors tended to see adverse effects. Now, 1 million, 10 million people are taking the drug within a year. So, lo and behold, if there are rare events, adverse events, they show up in large numbers, as it did with Vioxx. How are they going to detect a serious adverse effect that occurs in 1 in 10,000 people when they're only testing it on 3,500 people? That's the problem. There's also a problem with post-marketing surveillance. It's inadequate in this country. It's not required by the FDA. There's no real good system for it. That has to change. That's the problem with Vioxx. That's the problem with all the other drugs that Dr. Grigg talked about that pulled off the market. Had nothing to do with animal research, because the clinical study, the studies that the FDA required, were done in people. With the exception for testing for cancer and birth defects, because you can't do that with people. Although some people now are arguing that we should. I do not agree. One of the things that Dr. Grigg says over and over is that 20% of, what was it? when drugs are tested, when they enter clinical trials, only about 80% of them fail. Only about 20% get through the approval process. And he blames animal studies, claims that's the problem, because the animal studies didn't show that 80% of the drugs have serious adverse effects with humans or may not be effective. Well, he's not discussing the other numbers. The other numbers are this. When drug companies are trying to develop a drug, they'll go through 5,000 different compound screening. Only 250 will make it into the laboratory for the preclinical research involving in vitro studies and animal studies. Out of the 250, the in vitro studies and the animal studies will show that 245 of them, 98% of them, are ineffective or too toxic. They will not be used on human beings. So that's the number that he doesn't like to confront you with. Yes, 80% of the medicines, new drugs, that enter clinical trials don't get through. But that's not because animal studies fail. What the animal studies did was it highlighted, it told the researchers what to look for, what organs may be affected, so that in the clinical trials they watched more carefully, looking for signs of toxicity. And that's the reason many of these drugs do not get through phase 1 or phase 3 or later on phase 3. Science learns by making mistakes and then correcting them. What opponents of science love to do is to shift through the scientific record and pull out studies that were wrong, while ignoring or even denying those that were right. Dr. Green, unfortunately, does this. He's filled 3 books with things taken out of context, things misconstrued, and things just plain falsely stated. I am going to jump to some examples. Before I do, I wanted to say, tell you what Dr. Thomas Stossel, the noted pioneer for transplantation, said about animal studies. He said about his own pioneer work for organ transplantation, he said that the first study he did, most of the subjects died. He learned from that and adjusted his technique. And the second round of studies for the transplantations experiments he did, most of the subjects actually survived. The majority did. The third set of experiments that he conducted, there was only 1 or 2 deaths. Nearly all the other subjects survived. His fourth experiment, every one of the subjects survived. The difference, the most important difference between these studies was that the first 3 were done on animals. The fourth one was done on babies. But Ingrid Newkirk, co-founder, president of PETA, says, there's no rational basis for saying that a human being has special rights. A rat is a pig, is a boy, is a dog. And yes, Dr. Stossel. Let me get to this. PETA's spokesman, Bill Maher, I love his politics, more or less, but he's a staunch spokesman for PETA, and he conducted a campaign against Columbia University recently, calling on them to stop their Frankensteining of primates. Unfortunately, Maher doesn't believe in vaccination either, he says. That's another theory that I think is flawed, and that we go by the Louis Pasteur theory, even though Louis Pasteur renounced it on his own deathbed, and said that Beauchamp was right. It's not the invading Germans, it's the terrain. David, did you know that Pasteur said that on his deathbed?
I was unaware.
Yes. He doesn't believe in the germ theory disease, and he says, to those people who say my father is alive because of animal experimentation, I say, yeah, well, good for you. This dog died so your father could live. Sorry, but I am just not behind that kind of trade-off. Well, that's what Peter, and that's what PCRM is all about. PCRM is a front group. It's funded and it's basically run by Peter. Physicians Committee, the AMA in 1991 censured the PCRM, saying the Physicians Committee for Responsible Medicine has been formally censored by the AMA for purposely misrepresenting the critical role animals play in medical research. I wanted to make a comparison, but I'm running out of time, so I'm going to rush ahead. Between some of I spent a lot of time reading through Dr. Greek's books, and I tracked down his references, and I found so many examples where he left things off, misquoted, misrepresented, distorted, or made things up. He quotes Stephen Schneider, this noted biologist, environmentalist, saying each of us has to decide what the right balance is between being effective and being honest, as a way of showing how some scientists are a little less than honest. Only he left out the last part of the quote. I hope that means being both. In one of his books, he has a reference to show that research of dogs did not lead to information, knowledge about diabetes. He quotes some obscure publication. He says, in 1895, Huntsman reviewed the literature and found 72 cases of diabetes accompanied by lesions of the pancreas. Well, several years before, there were experiments done on dogs where they removed the pancreas and the dogs became diabetic. So I don't know what this reference is supposed to mean. This is not legitimate scholarship. Yeah, that was that. Okay. Dr. Greek, in one of his books, says that there has been no, despite all these animal research, has been no improvement in the overall mortality, the adjusted mortality of cancer in humans. Well, let's take a look at the facts. Look at the cancer incidence and death rates in children. The incidence from 1975 to 2001 has gone up, but look at the mortality, dropping. Adult males, even lung cancer is taking a sharp turn beginning in 1990, and most of the other cancers are going down. Adult females, likewise. You can see how lung cancer went up, but it's flattened out and it's on its way down, as most of them are. And if you look at combined cancer death rates, it's dipping down. What Dr. Greek said is simply not true. Perhaps he doesn't think that there are people like me that are actually going to check these things out. Nicotine withdrawal symptoms were scientifically confirmed in humans in the 1970s.